Taseer Marwidi Spermogen Sperm Growth Therapy, offered by Taseer Dawakhana Private Limited. This course is prepared for the male infertility patients to cure the disease. By using this course, patients can recover their male infertility problems in few months. Now I will brief you about what is Taseer Marwidi Spermogen Sperm Growth Therapy, how it can cure the disease male infertility, why male infertility happens, its symptoms, reason of disease, indication, male infertility types, complete detail about the sperm quality and quantity. Viewers, male infertility is a problem causing inability to conceive live with the male partner. More than 7% of male in the sexual active age group of age under 45 years of age were diagnosed with fertility problems in the world. In year 2019, of this disease, 14% were diagnosed with the sperm related problem and 6% with the varicose. Fertility in male is evaluated by checking sperm count, sperm motility, sperm morphology. These abnormalities result in male infertility. There may also be nothing wrong with the sperm, but blockage in the sperm ducts that are making it impossible for the couple to conceive. What happens under the normal condition? The man's body makes tiny cells called sperm. During sex ejaculation, normal delivery sperm into the woman's body. The male reproductive system makes, stores and transports sperm. Chemicals in your body named as hormones that control this. Sperm and male sex hormone testosterone are made in the two stages. The testicle and the scrotum, a sac of skin below the penis. With the sperm leaves the testicle. They go into a tube behind each testicle. This tube is called as epididymis. Just before ejaculation, the sperm go from the epididymis into the other set of the tube. These tubes are called as vas deferens. Each vas deferens leads from an epidermis to behind your bladder in the pelvis. Then each vas deferens join ejaculatory duct from the seminal vesicle. When you ejaculate, the sperm mix with the fluid from the prostate and seminal vesicle. This forms semen. Semen then travels through the urethra and out of the penis. Male infertility depends on the body making normal sperm and delivering them. The sperm go into the male-female partner's vagina. The sperm travel through her cervix into her ureters to fallopian tubes. Therefore, if a sperm and egg meets, fertilization happens. The system only works when genes, hormones, level and environmental condition are right. Causes of male infertility. Male infertility is a common complex process to get your partner pregnant. The following most occur. You must produce healthy sperm. Initially, this involves the growth and formation of the male reproductive organ during puberty. At least one of your testicles must be functioning correctly and your body must produce testosterone and other hormone to trigger and maintain sperm production. Sperm have to be carried into the semen. Once sperm are produced in the testicle, delicate tubes transport them until the mix with semen and are ejaculated out of the penis. There needs to be enough sperm in the semen. If the number of sperm in your semen sperm count is low, it decreases the odds that one of your sperm will fertilize your partner's egg. A low sperm count is fewer than 15 million sperm per milliliter of semen or fewer than 39% per milliliter ejaculated. Sperm must be functioning and able to move. If the movement of function of the sperm is abnormal, the sperm may not be able to reach or penetrate your partner's egg. Hormones plays an important role in the disease male infertility, and there are several hormones which affect on a person from producing a child like testosterone, LH, luteinizing hormone, FSH. In general, the normal testosterone range in male is about 270 to 1030 nanograms per deciliter with an average level of 679 nanograms per deciliter. A normal male testosterone level peaks at about age 20 and then it slowly declines. Testosterone level above or below the normal range are considered by many to be out of balance. Luteinizing hormone is a gonadotropin, a hormone that affects the function of a sex organ. This is released by the pituitary gland in the response to luteinizing hormone. Luteinizing hormone releases hormones. Abbreviated LH. In females, LH controls the length and sequence of the female menstrual cycle, including ovulation, preparation of the uterus for implantation of a fertilized egg, and ovarian production of both estrogen and progesterone. In males, LH stimulates the testes to produce androgen, also known as interstitial stimulating hormones. For male, the normal range is 1.24 till 7.8 international units per liter. If luteinizing hormone LH level are below the normal range, it may indicate a pituitary gland problem. The pituitary gland may not be making enough luteinizing hormone, which may lead to low testosterone. Follicle stimulating hormone FSH is one of the most gonadotropic hormone. The other being luteinizing hormone. Both are released by the pituitary gland into the bloodstream. Follicle stimulating hormone is one of the hormones essential for pubertal environment development and the function of women's ovaries and men's testes. In women, this hormone stimulates the growth of ovarian follicles in the ovary before the release of an egg from one follicle at ovulation. It also increases estradiol production. In men, follicle stimulating hormone act on the Sertoli cells of the testes to stimulate sperm production. Spermatogenesis. Normal FSH level in male adult male are typically between 1.5 to 12.4 international units per milliliter. Follicle stimulating hormone level in male may mean that testicles are not functioning correctly, while low follicle stimulating hormone level in male may indicate a problem with the pituitary gland in the brain. There are two types of infertility, primary and secondary. Primary infertility is an inability to conceive a child after regular intercourse for at least 1 year, while secondary infertility occurs in couples who have previously been pregnant at least once but are unable to make another pregnancy. As per medical research, in 50 to 60% infertile cases, male have infertility problem. A number of causes exist for male infertility that may result in impaired sperm count or mobility or impaired ability to fertilize the egg. The most common cause of male infertility includes abnormal sperm production or function, impaired delivery of sperm, condition related to a man's general health and lifestyle and overexposure. Viewers, semen produces testicle. Testicles are very important in sperm production. If testicles are not working correctly, then it makes a problem. Good health is essential for both men and women. Male semen has normal sperm count. If a person is not meeting this given criteria, then he is not able to produce a child or make a woman pregnant. 50 to 60% are active motile. Viewers, a man produces 50,000 sperm in a minute, 72 million a day. These sperm get measured in 84 days. Taseer Dawakhana has been established in 1946 and you can recover from all disease by using Taseer Marwedi sperm sperm growth therapy. By Taseer Dawakhana, which is made with precious herbal ingredients and free from any side effect. Doctors and scientists of our institute, Taseer Dawakhana, work under the supervision of Chemo Dr. Tariq Mahmood Taseer, qualified doctors, lady doctors, pharmacists, and Hakim with prolonged research. Taseer Marwedi sperm growth therapy. It is prepared from 2 herbs and 100% effective. Taseer Marwedi sperm growth therapy cure azoospermia, oligospermia, necrospermia, varicocele, hydrocele, pus cell infection, hormonal level, maintain the pH level of person, increase the volume of semen, thickness in semen, sperm morphology, every type of infection, and start producing sperm, where person may be relieved from all fertility disease. Increase HGH hormone level, follicle-stimulating hormone, luteinizing hormone, and normalize the sperm count of infertile men so they become fertile. Taseer Marwedi sperm growth therapy is prepared under the medical principle and proper scientific method with updated machinery in Taseer Pharma Private Limited. During the treatment, you should follow the precaution for better result. Limit or abstain from alcohol and smoking. Abstain from the beef, rice, olive food, potato, bakery foods, and junk foods. Don't go for sex during the treatment. Avoid things that lead to prolonged heat for the testicle. Use fish, eggs, milk, butter, honey, dates, lemon, garlic, pumpkin, radish, carrot, and dry fruits in your diet. Try to eat meat on daily basis. So viewers, I will briefly explain male fertility in this video. If you known person have some problem, or call on us in our office timing, which is 9 AM to 8 PM, and discuss your problem. I hope this video is informative for you and helpful for you. If you like this video, kindly subscribe our channel and click on the bell icon. I will see you again in my next video, in which we will discuss new disease topics and treatment. So viewers, it's time to say goodbye. Have a nice day. Take care. Allah Hafiz.